My name's David Krieser. I work at Sunshine Hospital in Melbourne, which often gets a laugh in Australia. I've been there since 2002. This is not one of those talks with p-values, to echo what Fran said before lunch. This is a talk about an experience that I went through with my family and had chances to reflect on it. And through it all, asking myself, was I okay? These are our objectives, perhaps not as grand as saving the planet, but you never know. We'll talk about work-life balance, and I want to frame that as something we all know as a phrase, but challenge, because I think it's awful. It's like work's over here, but life's way over there in the distance, and I'll try and get there sometime. Work is a big part of my life. My wife would probably say it's the biggest part of my life. And it's a really important part of my life. So work-life balance, life-work balance, it's all irrelevant. We should be enjoying what we do. I want to recognise the effect of emotion on our work, on professional education, and touching on what Beck said, and perhaps some strategies, which I'm sure you'll have some as well. So how do we do it? We always do it with a case. So here's ours. 74-year-old female. No, this is not a misprint. Paediatric emergency doctor trained through the College of Physicians. I am talking about a 74-year-old female. And no, I didn't do a year of adults. So we'll talk about the case. She presents, there she is. She presents with abdominal pain. It's central, it migrates to the right iliac fossa. It's associated with some loss of appetite. It's been going for about a day. She's got some loss of appetite. I get her to jump, oh, hurts. I get her to cough, she coughs, hurts. Past history, she's got a bit of renal insufficiency, nothing terrible. She's had she's had some diverticular disease along the way, no allergies. Her heart rate's 70, and I haven't got SATs or blood pressure. Why such limited information? That's mum, yep. So I was at her place. We were coming over for Friday night dinner. She just turned 74. We're going to have a bit of a party. That's a little corner of my son's head at his year 11 formal 2 years ago. So she's sitting there at home. What has she done? She's called the GP and set up an appointment for Tuesday. It's Friday night. I said, that's great, Mum. This will all be over one way or another by then. So, a little bit more family history. Those of you who are at SMAC or have seen SMAC or anything like that will may have heard me talk about my love of genograms and my lament that there is no good one in any electronic medical record. It's not true? It's true. It is true. You're agreeing with me. Thank you. So there's me, DK, and Mum, the crosshatch circle up there. There's atopic disease. I've got asthma and hay fever. My brother's got eczema and hay fever. There's another disease in our family, and it was the couple joined in. They're all medical practitioners. Not sure of the inheritance. I'm not a geneticist. The middle daughter-in-law there, my sister-in-law, she's also a lawyer. Just to make it worse. So, what would you do? So, we've got some options. Call the GP. Well, Mum did that, right? 6:15 Friday night. They're not around. Set up imaging yourself. My brother in Perth's a radiologist. He could have done that. And has. Go to the ED, the Department of Available Medicine. Or phone a mate. I'm not sure whether you get better advice from the dog or the guy with the VB. So what would people do? ED. So what did I do? I phoned a mate. I phoned my little brother, who's an anaesthetist at Royal Melbourne Tertiary Centre. And I figured, given he's an anaesthetist, he must know a surgeon. And sure enough, he rang the surgeon. We went to ED. So what happened then? So she saw lots of faces like these guys. and they organised the workup for wrist pain. Yes, we all thought she had appendicitis. And they did a CT. Adults get CT scans for query appendicitis. Who cares about radiation, right? And might even be therapeutic. And no, they didn't find appendicitis. They did some bloods. They found a pancreatic mass. Neck of the pancreas, which I didn't know was a place, and referred us for further investigation. So the further investigation involved another test that I'd never heard of. It's called an EUS, which is an endoscopic ultrasound. And they can put the probe down, the ultrasound finds the pancreas, which sits next to the duodenum, and they put a needle through and biopsy the lesion. So Mum had that, EUS, didn't know that was a thing. And then she got a complication of that, probably because all the family's doctors, and had a little aneurysmal pouch from a small vessel that was damaged. And spent a few days in hospital. And while she was in hospital, we got the diagnosis. So pancreatic adenocarcinoma in our family had caused a lot of angst about 10 years earlier with a very close friend of my parents passing away from this illness. And now Mum was diagnosed with it. So back to the faces, more faces. We met two surgeons. The first surgeon, who was an archetypal surgeon, poor on the communication, apparently had good hands. We never found out because we went to surgeon number 2. And surgeon number 1 vacillated a lot about where the lesion was and whether it was operatively reparable or not. Surgeon number 2 was very keen to operate and came up with a plan for a subtotal pancreatectomy. We met an oncologist as well who put out the lie of the land, told us the literature. Standard of care, operation, recuperation, chemotherapy that's usually pretty well tolerated, and all the evidence is that you have to give it within 6 to 8 weeks of surgery. Wasn't to be, of course. Mum had a complication. As soon as they incised the pancreas for the subtotal pancreatectomy, she developed an immune response. She became very cardiovascularly unstable. She was on multiple inotropes and went to ICU. She had huge complications. Inotropic support, ventilation, renal insufficiency, hemofiltration, developed, very importantly, enterocutaneous fistulae, and had 2 further trips to theatre, one to drain a bleeder and then one to complete the total pancreatectomy that many people think would have been the better operation. But that was a choice she made and Dad made together, and that's fine. She underwent that Whipple's procedure, which some of you may have heard of, while she was already on inotropes and got through all of that. In total, she spent about 12 weeks in ICU, about 4 months in hospital, 4.5 months in hospital, and came home with a nasojejunal tube and receiving feeds only via that tube. She couldn't eat because of the leaks from the gastroduodenal anastomoses and leakage of fluid. So, life is what happens to us while we're making other plans. You'll know one of those two guys. So issues that came up through this period of time. So the first one is distance. For those of you who don't know Melbourne, I live at the purple dot in Bayside suburb. I work at the green dot at Sunshine Hospital, and Mum's care was way up at the red dot. Each of those arms of the triangle about 40 k's apart, and depending on traffic, 40 minutes to an hour and a half in distance. And trying to juggle my days around work, which I thought was really important and perhaps was one of my coping strategies, was really important. I had some other priorities. So my family, I had a child in year 12, and so he started in February, year 12 in Melbourne, call it VCE, and Mum was diagnosed in March. So his whole year was dominated by Mum's illness. I wanted to keep working and doing the things that I like to do in my work, and some of the things I don't like to do in my work. And I wanted to exercise. No, I don't swim like this. There are no ripples, no sense of power when I do breaststroke. Those staying at the Mantra will have seen that this morning. Might have. Issue around fatigue. So real actual tiredness. Driving for 3 hours a day in Melbourne traffic or any traffic is tiring. Trying to work. And then there's emotional fatigue. It's available for Mum, available for people at work, available for people at home. emotional fatigue and also uncertainty. I think uncertainty is a huge part of what we deal with at work. I don't know why your child got a virus. You just got it. That's life. But dealing with that uncertainty is really important. And for us, it was uncertainty about the diagnosis, then uncertainty about her progression, and uncertainty about the fact that she wasn't getting the best care. She was still in ICU at that 6 to 8 week mark that is the standard of care for pancreatic cancer. Right? She was not going to get chemotherapy. At least she wasn't going to get it at a time when all the evidence suggests it might help. Something like this will happen to all of us. There's me, there's you, there's somebody else. It may not be a critical illness, it may not be a critical injury, it may be something much different, but it will affect how we work. And it may be happening to you right now, and you're at the conference despite what's going on elsewhere. So how do we talk about those things? How do we think about them in the context of supervision, of training, and all the things that we need to do? This is what happens, of course. We get stressed. We feel like we can't cope. The situation is beyond us. And are there training? Is there any way that we can train? Well, the first thing is, many of you may have remembered this from first year of whatever course you did, the Holmes and Ray stress scale and life events. Right? And these are the top 10. Interestingly enough, marriage and relationships constitute 3 of the top 10. And a score of 300 is a risk factor for life, for disease, a score of 300. But there's also a challenge, and a Holocaust survivor, Viktor Frankl, said between the stimulus and the response there is a space. And in the space is our power to choose our response, and in that response lies our growth and our freedom. This is a really challenging quote because we don't necessarily choose our responses. My response was to keep working, my response was to keep swimming, and my response was to keep doing the things that I thought I was going to do. Now, was that the right response? Was that a response that filled me with growth? I don't know. That was my response. So it's challenging, and it may not be correct. We finally come to training, and these are things that we know and love. We take knowledge, we take skills, we take attitudes, and we turn them into whatever we become. Paramedics, nurses, doctors. And this is the easy bit, skills and knowledge, right? These are routines we know. We read, we go to tutes, we have exams. The College of Emergency Medicine has turned WBA into a 4-letter word. And there are term reports. But what about these? What about these attitudes? I have no answers, right? Are these important? I think they are. We know that from some of the medical defence and legal literature, that communication is the first problem when there are complaints. So we know that attitude's important. But that's not the reason why they're important. They're important because, as we saw today, being nice, being compassionate actually is better medicine. Better medicine from a patient view. It's much more fun as a doctor as well, if you can communicate well. Can they be taught? Well, yeah, I think they can. Certainly teach people what not to do, and that's part of that developmental feedback. I love that. How do we teach them? We teach it by role modelling. I'm hoping to teach at least one person in the room to think about this stuff and go on with it, because I never did. And how do we assess it? Well, do we need to assess it? Is it enough to reflect, to self-assess? I think that that's something that we can discuss as well. College of Physicians has pages like this from the professional qualities curriculum, and it identifies stresses. The paediatrician will identify stresses and take action to minimise their effects. We will effectively manage the balance between work life and home life. There's that horribly uncomfortable division again. That's the College of Physicians. The College of Emergency Medicine, in their professionalism table, has a bit here. It's a progression where the trainee will just begin to appreciate the mechanisms to protect themselves from the detrimental effects of stress. And they'll get a bit better as an advanced trainee, and then as a consultant, they will express responsibility to everybody and everything. At no point in any of these curricula is there a way to do this. At no point is there a test, is there a way of saying, well, I have reached nirvana. I think this is something that we need to talk about. This comes to professionalism, and there are books on it, teaching medical professionalism, and there are clouds of thoughts about compassion and honesty, and pillars of things like clinical competence, communication, ethics. I'm not minimising these. I think these are vitally important parts of what we do, and we're probably doing a lot of it without being mindful of it. And that's what I want you to be. I want you to be mindful of the effects, the things that happen around us are really, really important. There is an Are You OK Day in 2 weeks. And some of you on Twitter would have seen Casey Donovan promoting that. She won Australian Idol and then disappeared for a while, had huge mental health problems, and is now singing Down, Down, Prices Are Down as some sort of cruel joke. But this is important, and we need to ask, and we need to listen. But we ask, are you okay? What are you going to say if the answer is no, I am not? Yeah. And what do you do if the answer is yes? That's right. Encourage action and check in. It's really important. All right. So let's have a summary. A lot of us been to APLS. We need a summary. Think about how work impacts on life, how life impacts on work, and let's try and get rid of that dichotomy between work and life. But let's advocate. And key performance indicators are important. Many of us will be battling with 4-hour targets and 24-hour targets and things like that, door-to-needle times. But what about a target that looks at adequate staff and adequate supports? Hospitals are famous for taking a job they know will take 10 people and seeing if 7 can do it. Right? Well, let's see if that job with 10 people, actually we should employ 12, because something will happen to somebody, which means that there's actually 10 bits of work being done. So that's part of having a safe working environment. So their summary sheet is not the last slide. This one is. So what happened? So October came, so it's now 7 months after her operation, and I make a phone call, and Dad answers the phone. In the background, Mum's coughing. At least I thought, is Mum coughing? She said, no, she's gagging, been vomiting for a couple of hours. What did you do? I went to the chemist and got some Maxilon. Okay. She have it? Yes, she had it. Has it stopped the vomiting? She feels a bit better. Stop the vomiting? Not really. So, well, look, if it keeps going, give it another... How long ago did you take the Maxilon? Maybe half an hour. I said, give it a little bit more time, and then if it's not quite right, give me a call back and we'll see what we do. So we ended up in hospital. Her vomiting became more brown, and her pain got worse. And on Tuesday morning, she went to theatre. She had a large bowel obstruction. Her intra-abdominal contents were fused together from that initial operation where there was a pancreatic leak. The bowel obstruction could not be relieved, and we were advised that she would be either TPN dependent for a minimum of 6 months, or we could go through palliative care. And so on the 29th of October last year, Mum passed away. Thanks very much.